Meet Carla, a 67-year-old who was brought to the ED after her family noticed sudden confusion and slurred speech that resolved within an hour. She admits to occasional blurred vision and memory lapses over the past few months. Notice, Carla's episode matches a transient ischemic attack, or TIA, which is a stroke-like event that resolves within 24 hours, along with a history of blurred vision, confusion, and memory loss. A carotid ultrasound reveals significant narrowing of her carotid artery, confirmed further by angiogram and MRI. Interpret. Carotid artery disease is the narrowing and damage of the vessels that supply blood to the brain. This narrowing is caused by atherosclerosis, a buildup of plaque along artery walls, often driven by risk factors like smoking, hypertension, high cholesterol, and diabetes. Years of these risk factors gradually built plaque in Carla's carotid arteries, reducing blood flow to her brain and triggering the transient symptoms. This condition is often undiagnosed until a TIA or stroke occurs. Respond. Initial management includes targeting risk factors along with vasodilators and antiplatelet medications to improve blood flow and reduce clotting risk. If the artery is narrowed by more than 70%, an atherectomy may be needed to restore adequate blood flow and prevent a more serious event. Reflect. With treatment and risk factor control, Carla can expect reduced future TIA episodes and preserved brain blood flow. Left untreated, worsening narrowing significantly raises her risk of a full stroke, which can cause lasting neurological damage. In summary, carotid artery disease is narrowing of the arteries supplying the brain from atherosclerosis. It often goes unnoticed until a TIA or stroke. Treatment combines risk factor management and antiplatelets with surgical intervention for severe blockages. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.